fantastic question, right? So obviously, who are we and what do we do? So I'm a solo practitioner in the state of New Mexico. I'm a urologist by training, and now over time, I've evolved to basically specializing in men's health. So that's our name, MD for Men. And so we only do 5 services. We really kind of in a niche practice: vasectomies, testosterone, erectile dysfunction, curved penises, enlarged prostates, bladder health, as well as just overall wellness. So that's been our main focus. And more importantly is, what is our purpose? And that's a really interesting question, because it really starts with the mission initially, which was to empower men with the guest experience to evolve fearlessly into the best version of themselves, to positively impact their personal, professional, community, and global relationships. Interestingly, the vision took a little bit while longer. I think it's really tempting to go, hey, I want to be the #1 men's health center. But actually, I realized that one day a guy came and I said, well, how'd you find out about us? He goes, yeah, a buddy of mine says you're the go-to place for this problem. And I realized it's about building community. And so the vision really was to be the go-to place for men's wellness, because it's part of the community within which we work. And so that's kind of what we do and how we do it. Number of employees, we have about 5. That's been changing dramatically up and down. The pandemic was really hard for a lot of folks, especially us. We almost shut down multiple times, and now we're just slowly rebuilding. That's a fantastic question, which is, how do you scale up a practice and private practice in this day and age? That is a loaded question, because it really depends, right? We now need to have a real holistic look to healthcare in general. One, look at our country, then look at your state, look at your region, look at your city, look at your community. But then beyond that, look at the needs also of your family. And when I say that, it's twofold: your business family and your own family, personal family. And then finally, look at your own needs. Why do I say that? At every step in that journey, we're looking at what I call emotional overhead, believe it or not. Every relationship we choose to partake in takes energy. It also takes energy away from your practice, your personal lives, your professional lives. So you need to be able to allocate that very judiciously. So when we look at how many practitioners we need, well, based on that need that we've talked about for our country, our state, our region, our city, our families, and ourselves, we then have to start off at a certain best guess, and then based on that, understand the services that you're going to provide. How many staff members do you need to make that work? And more importantly, to really dial in your vision, your mission, your service values. So for example, for us, we want all of our services to be simple, safe, effective, efficient, and personalized. And then our business values, we want to be adaptable. We want to be held accountable. We want to be interdependent. We want to over-communicate, and we want to systematize. And when you know all those things, and we talked about our vision and mission, you have to then look, how many support staff do you need to create that experience? Not just for your patients, but also for your providers, and also for yourself, and as well as for the practice. And so you can see right there and then, you now start to have to calculate on all those factors. Some are very tangible, some are not very tangible, but together those will give you the exact number of where you start and how do you scale up to create that experience for everyone, especially in this day and age post-pandemic. We're all looking for a positive experience. And how do we get there? And it's taking the time to really take stock of all these individual entities, both emotional, physical, intellectual factors that come into play, as well as financial and operational. That's another great question, which is, what are the top KPIs that we need to be looking at as we are trying to not just survive, but really truly thrive in private practice? That's another very large question, because it depends on where you are in the journey. Are you starting out? Are you a startup? Are you growing? Are you adding on new practitioners? So once again, I can't overemphasize this, which is, as you build the culture financially, the culture operationally, understanding who you are, what you want, and what is your why, because that's going to dictate how you look at your KPIs, right? If it's all about money, then obviously top line, your overhead, your profit. But if it's more than that, if it's really about driving an experience, then you have to understand what are your key revenue streams? How are they doing? Those key revenue streams, which drive the vision and the feeling and the experience of your practice. So for us, obviously, we look at those. We only have 5 main services, so looking at those main revenue streams. And then understanding that, making key decisions about what insurances are being paid. Look at your AR. Are there certain associations with delayed payments with certain insurances? Also, how do we begin to look year over year, month over month, and look for patterns? And what are we willing to invest in? What are we willing to actually have lost leaders in? Things that we know, hey, that's maybe not the most profitable, but we see this added benefit in building culture, in building the experience, in cross-pollinating to other revenue streams that may be more profitable. So those are probably the biggest ones. The other thing I really look at every time is actually a mental thing, which is what is my emotional overhead? The number of relationships I have to manage as a CEO, as the number one provider and the only provider for my practice. And believe it or not, especially as we think about that, it's becoming harder and harder, but how do we work smarter and more efficiently? And one of our biggest costs is actually emotional overhead, which is all the relationships and what it takes. And that's going to take a journey for yourself to understand yourself, what your needs are as a practitioner, as a person, how you interact with others. And I think those are really kind of my KPIs that I kind of work with. Fantastic question about what is a piece of advice I would give to other owners of private practices. And the number one thing is recognize that fancy acronym, right? CEO. We hear it all the time. But in this case, it's not Chief Executive Officer, it's Chief Energy Officer. It is your job to recognize what builds positive energy. And we have to believe in that philosophy that what we do, and with every individual interaction, whether it's with a patient, whether it's with another colleague, whether it's with one of your staff, we have the ability to create a positive experience that creates a immeasurable positive ripple effect in some special way. And to understand that, but the experience of trying to manage energy, we have to first understand fear. Fear drives so many decisions. We have to look inward to understand, what do we fear? We look at our patient population, what do they fear? As well as the practice and your staff, what do they fear? And begin to understand the dynamics of that. How do we work through that? I would say that understand that fear can be a positive thing as well. We need to understand one of the biggest things is confrontation. How do we have positive confrontation? How do we harness that energy that feels negative and turn it into something positive? And probably something I'd recommend for all private practices is actually, I use this book a lot, The 4 Agreements by Miguel Ruiz. I will tell you that one of the biggest issues in any corporation is making assumptions and taking things personally. When you are able to explain using the 4 agreements, all my staff read it, and just understanding the principles. Hey, we're all trying our best. We're all being impeccable with our word. But more importantly, the 3rd and the 4th agreement, let's not make assumptions and let's not take things personally. We begin to use that with any tough situation which feels negative, and we can now convert it and transform it into something positive.